With me today is Dr. Mayur Kardile, the director of the Pune Spine Institute and also associated with the Jehangir Hospital. Doctor, welcome to Candid with Karl.
Thank you, Karl. Thank you for having me over here.
You're welcome. And let me start by asking you, what to you is a spine specialist?
Karl, a spine specialist is somebody who understands spinal pathologies,
Right.
And he helps patients to diagnose their problems and to provide treatment, which could be surgical as well as non-surgical, and help them get rid of their spine problems.
Wonderful. And how did this whole thing transpire, Doc? It's a very specialized field.
Yeah.
So how did you choose this particular department?
Yes. It's a long process, actually. From the time that you think of becoming a doctor to becoming a real-world spine surgeon, it takes about 14 to 15 years. That's
Right.
the timeline that I have spent in.
Right.
So basically, being from the millennial generation, always it was either you become a doctor or you become an engineer.
Absolutely.
Yeah.
Or you become a chartered accountant.
Or you become a CA.
Yeah.
So, or the next lot comes the lawyers.
Correct.
Right. So that was the norm in our generation.
Right.
And being good at studies, it was always like, okay, ye ladka to doctor banega.
Right.
Right. So, and eventually certain things happened in our family. Like one of my cousin underwent a cardiac surgery.
Oh, I see.
That is something that really motivated me
Right.
to become a doctor. And yeah, of course, it was pretty competitive. And I think I was very good in studies. I cracked the entrance exam, became a doctor. And when I got admitted into a medical school, Pune Institute of Medical Sciences, and that is exactly where I met my mentor.
Oh, I see.
I think I would put a lot of importance to mentorship.
And who would that be? Who was your mentor?
So that's late Dr. Ketan Kurjekar.
Right.
He was a spine surgeon in this city. I met him very early on in my medical school in my second grade. And you know what? It was more of a hero worship, the kind of persona, aura, and the conduct that he had and the way that he would help patients that really motivated me to become a spine surgeon. And he mentored me through this whole process.
Right. Now, I know you spent a fair bit of time in the United States.
Yeah.
You studied there also.
Yeah.
Which part of the States were you?
So I was in the San Francisco Bay Area.
Okay.
It's a hospital chain called Kaiser Permanente.
Close to the Golden Gate?
Oh yeah.
Okay.
I could see the Golden Gate from my office.
Wow.
So beautiful place.
Right.
So it was a Northern California Regional Spine Surgery Center where I did my advanced spine surgery training.
Right.
And amazing place, lot of advanced stuff in spine surgery. And then I also did some research projects with UCSF, that's the University of California, San Francisco.
Okay.
So that was my entire journey of advanced spine surgery that I had.
And how long were you in the Bay Area?
I was there for 1.5 years.
Excellent. So normally it's, back in the day, it was our dream and Indians' dream to go and practice in the United States or Canada or the UK. So what made you choose to come back to India?
United States is a very tempting place. You go there, you feel like, okay, that's the...
I've reached the promised land.
Yeah, you live the American dream.
Right.
And I even had that kind of a track that you could join in and get absorbed into the system and work there as a spine surgeon.
Right.
But, the larger calling was that the reason why I went over there was to learn all the modern techniques of spine surgery.
Right.
And get them back here to India.
Oh, I see. Okay.
And help out our people, our population to have access to that kind of a care.
So to you, Doc, what is the key component of being a good spine surgeon?
I think it's in your mind.
Okay.
Yeah.
Okay.
You need to have a very sharp and a very composed mindset to become a spine surgeon.
Right.
See, spine surgery is fine art. It's like
Absolutely.
Things go in micromillimeters over there.
Right.
So you need to be very analytical.
Right.
You need to be very good clinically to understand your patient's problems.
Right.
Talk to them well.
Right.
And diagnose them well.
Right.
And then when it comes to execution of surgeries, spine surgery just has to be perfect.
It has to be.
It has to be perfect, right?
I mean, one wrong move and you could be paralyzed.
Oh, yes. So, there could be a good surgery and there could be a bad surgery. And in between, there's a wide gray zone.
Oh, I see.
But in spine surgery, there's no gray.
There's no gray zone.
There's a good surgery, excellent, and
there's paralysis.
yeah.
But tell me one more thing. I'm sure this is a question asked many times to you. Somebody comes to you with a set of X-rays, or an MRI, and they'll tell you, Doc, it doesn't look too good.
Yeah.
Now, when you read these reports, are there times when you tell a person surgery is the only recourse? Or would you sometimes advise people that the surgery could be delayed?
Oh, you know what, Karl? It's a misconception that visiting a spine surgeon would always mean surgery.
Right.
In our practice, 90% of the spine problems get dealt without surgery.
Is that so?
Yeah,
Right.
totally. And with that, we mean by a short course of medications, physiotherapy, your exercises, lifestyle modification, and a lot of times those problems can get treated.
Straight.
Surgery is required in 10% of those.
That's all.
People. Yeah, 10%.
I see.
Yeah.
I see.
But
So what you're trying to say is, of the 100 people that come to you, you only 10 people require surgery.
yes. Yeah.
Wow.
Yeah.
Wow.
Over a period, it may change that more and more people come to us for surgical opinion. And that has been now our experience that people would have been advised spine surgery elsewhere.
Right.
We being a super specialty center with a lot of experience in spine surgery, a lot of patients come to us that, okay, we've been advised surgery. So kindly tell us how we would go forward with this. So that's why the numbers may deviate now.
Right.
But in a pool of, say, 100 people with back problems, 90% will get better without surgery. And yeah, of course, like you spoke about paralysis. Touch wood, we have never had paralysis in our practice.
Right.
Probably we're doing something right over there.
Absolutely. Absolutely.
So a wide spectrum of spine problems can be better with lifestyle modification, exercises,
Right.
weight reduction.
I think today's life becomes very sedentary because you're behind a computer all day long, whatever profession you're in. So I think a lot of things which are curved spine, you could probably advise a lot of people posture being the key to a good spine, or having or not ending up being spineless.
Yeah,
Yes,
of course, yeah. So I think as we are evolving, like we evolved from apes to humans.
Yes.
We were quadrupedal, now we are bipedal, we were erect.
Right.
But now with the advent of all these smartphones and gadgets, we are more into this flex posture, right? So that's, I think, that's jeopardizing our spine a lot. Lack of exercise, the proper posture. And those are the things which are really increasing the number of spine problems.
Doc, you like a good dentist. He'll always advise you brush your teeth twice a day and stuff.
Yeah.
What do you advocate for people? I mean, just so that their spinal problems can get minimized.
So two things.
Right.
Good posture while you use your
Which is an erect posture.
Yeah, erect posture.
Right.
And second thing is exercise.
Right.
Every day.
Okay.
Every single day you have to exercise your spine to keep your muscles strong and have a...
Any specific set of exercises or?
There's a whole lot of it.
Right.
It's grouped under a thing called as core strengthening exercise.
Right.
And paraspinal muscle training. So if I have to tell you one easy way of without visiting a doctor or anything, you guys want to start on with certain exercises for your spine, Surya Namaskar.
Okay.
That's something really is pretty comprehensive.
Wonderful.
Help you to reduce back pain.
Right.
And of course, walking. As you walk, a lot of your muscles get exercised.
Yes.
So that is something that I would really swear by.
Yes. Now I know that you're the only person in India who's developed this term in spine surgery called ALIF.
Yeah.
Can you please tell us and enumerate more on what exactly is ALIF?
Yeah. So, Karl, my mission has always been, how do we serve our patients better?
Right.
How do we get them out of pain faster? And how do we put them back to their original lifestyles that they would want to? Lifestyle, vocation, vacation.
Pre-surgery, post-surgery.
Post-surgery.
Right.
Yeah?
Right.
Or get them back to better functional status. Right?
Correct.
So we've always been thinking about those things. Now, you must have heard that all spine surgery is done from the back.
Yes.
Right?
Yes.
But there are certain surgeries wherein we need to put in screws and implants and cages in the spine, in the lower back. And while we do that, I realized that, we are handling too much of tissue over there.
Right.
Or we are handling too many nerves over there.
Right.
And that has its own set of problems.
Right.
So I learned this technique in the United States that you can do spine surgery from the front, from the belly.
I see.
Okay.
So you mean doing a spine surgery when you're lying on your back?
Yeah, you're lying on your back.
Oh, okay.
And there's a God-gifted natural plane in the belly,
Right.
From where you reach to the spine without disturbing or cutting a single muscle or anything.
Incredible.
Yeah. You reach there and...
and is this technique known to a lot of spine specialists?
Yeah. It's not new in the world as such. In Western countries like United States, Australia, parts of Europe, it's pretty... it is practiced.
Right.
Over here in India, there were pretty much challenges that no one was doing it.
Right.
And if there was somebody doing it, the implants were not available.
Oh, I see. Okay.
So when I came back from US, the first thing that I worked on this project was to design this implant for anterior lumbar interbody fusion. And we made one of the finest implants in the world.
I see.
Made in India,
Right.
right here locally, at a very affordable price for our patients. And then we've been doing all those kind of surgeries. And believe me, it's a whole 360-degree shift to spine surgery. The outcomes have been phenomenal. The patients' return to activities have been great. And the long-term outcomes now we can boast our data of 5 years now.
Right.
For ALIF,
Right.
they've been exceptional.
I see.
Yeah.
And your success rate has been what? In terms of percentages?
You know what, if you really...
When I'm talking success rate, I'm talking about people extremely satisfied.
Extremely satisfied is 99+%.
Wow.
Yeah.
Wow.
And I think a lot of that goes to a big process of meticulously understanding the patient's problems,
Right.
meticulous patient selection, and giving them the
When
right
you say patient selection, is
Yeah.
how really can you have to finally work with who come to you?
Yeah, exactly. Patient selection in the sense means patients don't segregate themselves while they come to me,
Right.
But I have to make a clinical judgment what kind of treatment would suit best for this patient. So as we spoke about, 90% of these patients would get better without surgery. But those 10% patients whom we advise surgery, those are the ones who are bound to get surgery sooner or later.
Correct.
Or they just live with that pain.
Right.
Okay.
Right.
So identifying that, treating the 90% without surgery. And now when you identify those 10%, what surgical approach would be the best thing for them?
Right.
Would promise the fastest recovery. Selecting that and be technically very good at performing it and delivering it. I think that is something that translates into that high level of success.
Your
after
total
spine.
technical proficiency.
Yeah. And of course, rehab.
Yes, of course, that's part of passport, postpartum, yes. But I think, if I were to ask you, is there any case or cases you have that you'd like to highlight?
Yeah.
Something different that happened, or any particular case that you'd like to share with us?
Yeah. So, you know what, I've done personally in my practice over the past 7 years in Pune, I must have done more than 5,000 surgeries.
5,000 spinal surgeries?
Yeah.
Wow. And I'm just feeling like maybe I should get one right now.
And overall in these 10 years of spine surgery, I must have done around close to 7,000 to 8,000, somewhere around that, 7,000 at least. So you tend to remember certain patients very peculiarly. I'll share 2 cases with you.
Right.
One was this young boy, 21-year-old, somewhere in Bihar, and he's a tattoo artist. Okay. He worked in a mall to draw tattoos on people.
Right.
And he had a bike accident. Complained of neck pain and only neck pain.
Fractures and stuff?
There comes the story. So there's certain things like preliminary investigations reveal that nothing, there's no problem, just a muscle strain or probably. And then he went home and gradually started losing his ability to use his hands.
Oh.
And
as a tattoo artist, that's all that you have.
He's right. He's losing his livelihood.
Yes.
And then gradually he started feeling weakness in his legs. He would sway while walking. And,
and this happened over the period of time?
Over a period of like a couple of months. And sometime back, I had operated a patient with a spine problem. And her son reached out to me. Hey, doc, you know what? There's this person in need. I think he would be benefited with some spine care. Can you take care of him?
Right.
Luckily, we had funds that time. They're like, okay, we just get him. We'll take care of him. And
like a pro bono case.
Yeah, pro bono.
Okay.
Yeah. So I think more satisfaction comes from through those things, right?
Yes.
So you get him over, and we diagnosed him that exactly the root of the neck and where the thoracic spine starts. The spine had dislocated and lodged itself over there. And it was creating severe pressure over the nerves, difficulty in using his hands.
Right.
So I said, okay, you need surgery. And this was a surgery which needed 3 stages. So you operate from the back, then you flip him over, you operate from the front in a very critical area, and then you flip him back and then again operate from the behind. So 3 stages, same patient, 9 hours of surgery. And next day morning, this patient wakes up, doc,
wow,
this is moving.
Right.
You know what?
Can I tattoo? Thank you, doc.
Yeah. So I'm moving my hands.
Right.
I'm he's walking better, right, the next day.
Instantly after the surgery, yeah?
Yeah, just basically 1 day after the surgery. Okay? After this extensive 8-9 hours of surgical exercise. And then 2-3 days back, he goes home later. We did some online follow-ups with him. The wounds healed, everything was fine. And 3 months later, he comes back and says, Doc, you know what? It's not only my life that you saved, it's also my family's future that you have saved. I've started doing my tattoo work again.
This is really, a lot of nobility involved here. Yes.
Yeah.
Yes.
So I think I remember that case quite vividly.
Yes.
Second one, I would say there was this lady from Pune who had a curved back. There's a term called as degenerative lumbar scoliosis. Now, spinal...
And Doc, how old was this lady?
So she was around 55, 56 that time.
Right.
And she was in terrible pain. That walking a couple of steps would make her feel fatigued. She always had to have somebody holding her. And very nice, elite, very well-educated family.
Right.
And she went all over, probably at least 7 to 10 spine centers in India.
Right.
And she was advised the same routine stuff. So this is the place where diagnostic tools, like we did a different kind of X-rays and MRIs for her and found out that her spine was deformed. And now that's...
Since birth?
No. All this happened later. We'll talk about the since birth problems also. We do a lot of that.
Right.
So spinal deformity is one of my niche specialities.
Oh, I see. No, so in this lady's case, it got deformed over the period of time.
Oh. Okay. Oh. And then the spine was twisting over itself. It was causing a lot of muscle fatigue. So I advised her surgery. We prepared her for over a period of 6 to 8 months to build up her bone quality, and did a stage surgery. First did it from the front, and that time that was the time that we had just launched the ALIF system.
Okay.
And it worked so beautifully for her. We did the front surgery first. 2-3 weeks later, we got her back and put in screws from behind, and now she's completely straight.
Wow.
Doing everything, traveling all over the world, getting into a helicopter, getting down, getting on planes.
Pain-free.
Completely pain-free. And I think this is the kind of care that she would have got if she was back there in San Francisco where I trained, or Oakland where I trained, right? But she gets it over here. I think that is a dramatic shift that we could create from getting the same kind of healthcare from there to
ours, Doc.
So these are the patients that I really remember very vividly.
So you virtually opened the doors of the Golden Gate for this particular...
Totally, sir.
Wow.
Golden Gate to India Gate.
Wow. India Gate. Right. Fantastic. So you were saying about people with spine problems since birth.
Yeah.
Yeah. So how does that work?
Yeah. So, now normally spines have certain curves. Like if you look at it from the front, it has to be straight.
Right.
And if you look at it from the side, it looks like a S-shaped curve, right? Certain babies are born with certain anomalies in the spine, wherein the vertebrae or the bones which are there in the spine, they're not of the a particular pattern.
Right.
They are abnormally shaped. And then as those babies grow, the spine becomes tilted or it gets crooked. So this is a typical term called as scoliosis.
Okay.
And you must have seen kids with hump.
Many times. Yeah.
So
walking at odd angles.
Yeah. So those are the kind of problems that we treat.
But with corrective surgery, can this be completely realized?
Yes.
Completely, yeah?
Yes.
Wow.
So we've done over more than 300 surgeries of that kind, wherein we are helping
infants.
No, not infants. Over a range of say about 5 years to 15 years.
So let's just say, Dr. from your layman's perspective, as a parent, you know that your child is walking abnormally.
Yeah.
Right? There is a curvature that is noticeable. What should the parents' recourse of action be?
Yeah. You know what? There's something called a school health screening program where we provide support to schools to help screen children with spinal problems early on.
Right.
That is one thing that they can identify it early. And if a parent has a doubt that their child's back is crooked or tilted, the first thing is that they should see a spine specialist or a spine surgeon rather. There's a whole lot of dilution of the spine specialist term. Visiting a spine surgeon, because there are a lot of things that we can do to prevent the progression of these curves,
right,
and nip them early and help the child to be better,
right.
And so you imagine, when I was in my school, I remember my cousin, she had to go for a send-off party and she had a pimple.
Right.
And she was like, oh, no, how do I go to this?
Right.
No? They have that inhibition. You must see.
Yeah, many times.
So-
In our field, it happens all the time.
Yeah.
Dermatology is a science in itself.
Yeah. And now imagine somebody with a crooked back,
Right.
a girl walking around like that in a community or at a school. The kind of social stigma that they have, or the kind of lack of confidence that they have.
Yes.
We do those surgeries for these kids and they evolve into a completely different person.
Wow.
A newfound confidence, they have a better posture, they look more confident and they're ready to face the world better.
Anything else, Doc, you'd like to share that, about maybe things that have enriched or uplifted your life?
Being a spine surgeon, we did not have any medical background in our family, and reaching to this level, like being a doctor, then being a super specialist spine surgeon,
Correct.
It's more of a humbling experience for me. I feel that it's more of a gift of God for us,
Right.
that you could elevate somebody's pain, elevate their suffering.
Right.
And I feel a moral responsibility to give it back to the society.
Wow.
So, for past 10 years, we've been working with this foundation called Standing Straight. It's based out of California. And we've been doing work in Jalandhar, northern India. And we've been helping these kids with scoliosis for the past 10 years.
Right.
We screen them, we advise surgery, we perform surgeries on them.
Right.
And at the end of everything, the cost of the surgery to these patients is zero.
Wow.
Normally a surgery which would cost about, say, 80 to 90 lakhs in the US.
Right.
You adjust that price over here, 12 to 15 lakhs in India.
Correct.
We're doing that all for free for these patients. And so who are these patients? These are kids of, say, really impoverished families,
Right.
who live on, say, meager wages or
Right.
delivery workers or chaiwala or those. So we treated those kind of kids. And over the period of 10 years, we have treated at least 150 kids of that kind.
Right.
And now we see that those girls have gotten married.
Oh, I
Have
see.
their own families.
Wow.
Those kids, they've now become, some have become doctors, engineers, they are now into competitive exams. So
Nice.
that was a really life-changing experience for them.
Right.
And I think more than what we did to them, it's the joy and
The joy that they brought
we get out of it.
Yes, and enriched your life.
Yeah.
Yes.
So that's a very exciting part of our profession that we could give back to the society.
Doctor, you've been in the field of spine surgery now for about 10 years. What or how have you seen this field evolve?
Yeah, Karl, you know what? There's a drastic difference in the way that we look at spine pathologies from the first day that I started training about maybe 12 years back.
Right.
Now.
Right.
That time it was all open surgeries, all wide exposures, and a lot of fixations.
Right.
To later on we evolved to more minimally invasive surgeries, more structure sparing surgeries, more less use of implant surgeries, and now we have further evolved to more of endoscopic surgery.
Right.
So a surgery which would say take a 10 centimeter incision, now we do it in a 7 millimeter incision.
Wow.
So less tissue trauma,
Right.
faster recovery,
Right.
and more precise diagnosis and treatment.
Right.
And further,
With virtually no visible scars too.
yeah, of course. Like you hard.
Because I think that would be also a thing, especially for a lady.
Yeah.
That if there's going to be a visible scar,
Yeah.
that I don't want to, it'll mar the beauty of my body and
Right.
all that
right.
kind of thing.
So when I do surgeries, we try to take hidden incisions. We try to keep it very cosmetic so that the scars are not visible.
Right.
And over a period now, we are more into motion preservation, making efforts to preserve the motion of the spine, say by doing disc replacement surgery
Right.
or in the neck as well as in the lower back. And further on, I think we're still going to be more and more precise with these endoscopic techniques.
Okay.
So now, still in a lot of infantile stages, robotics, AI, all those things will keep coming further as well.
Right. I mean, that's a whole different ballgame. I mean, robotics and AI would be totally, entering. And I think, we being such a lively person, I think let's just concentrate on what you can do right now.
And in fact, I would say today's time, a very well-trained spine surgeon is much better than the existing robots.
Right. That's fascinating. Actually. I think as we move forward, into this Tesla and age of electric cars and stuff, it's nice to know that there are still human beings that can perform the task better than anybody else.
Oh yeah, of course. You don't want to be in the autopilot. No.
Absolutely. No, especially with your back. I mean,
Of course.
Yeah. How do you think the media can play a role in effectively projecting this very specialized field to the masses?
Yeah, I think the outreach of media is very strong.
Right.
And spreading positive awareness is what would really make a difference. Positive awareness about preventive spine health,
Right.
importance of posture, exercise, and spreading the awareness that spine surgery does not mean paralysis.
Yes.
The awareness that, spine problems can get treated.
Right.
And possibly, see, the spine problems are so common in the society. If, say, a celebrity or an influencer can talk about how they overcame their spine problem and how they've been better through the treatments,
Right.
I think that would really reinforce that confidence in this specialty for a lot of people.
Yes. Absolutely.
Yeah.
Doctor, we often tell our kids, walk with your back straight. Keep your chin up, walk with your back or chest out. Little realizing that the back is the fulcrum of your posture.
Yeah.
What advice would you give to parents who can pass this on to their kids?
Yeah. The biggest advice in today's generation, the Gen Z or Gen Alpha.
Yes.
We're probably raising the Gen Alpha kids right now.
Right.
So put them off the screens.
Okay.
Minimal screen time.
Right.
And send them out to play. Children are naturally agile. They're more athletic than adults. So you let them play well, they get exercise well. And I think that is the key indicator to a good spine health for them.
Excellent.
Very, very short in a nutshell.
Yeah, I think instead of playing soccer and cricket, they prefer playing video games.
Oh,
It's sad. Yeah.
let them have that real world experience.
Yes.
Right.
Yes. No, I think this will solve a lot of affiliated problems.
Yeah.
Like stress, for example.
Right.
With the more you are looking into a particular screen and into a particular device, the lesser your worldview becomes.
Yeah.
So I think if that worldview gets expounded, naturally a lot of problems also would get alleviated.
Of course. Yeah.
Dr. Mayur, as we come to this absolutely fascinating session, and we are set to close,
Yeah.
do you have any thoughts that you'd like to share with the audience on what you'd like to leave them with as a spinal surgeon?
Karl, I would always tell the audience or whomever I would meet, first of all, having a spine problem is quite an emotionally burdening thing.
Yes.
A lot of people I see that they've been suffering through those problems over years,
Right.
and not being taken care of or not accessing care just because of the fear. So first of all, I would say, leave the fear aside.
Right.
There's a lot of options of
A lot of misconceptions, absolutely.
misconception that, okay, spine surgery is always going to lead to paralysis, it doesn't work, I'm going to get bed bound. All that, with the advent of modern era of spine surgery, that has almost gone.
I see.
I won't say zero, but
Right.
almost gone.
Yeah.
And now the outcomes of spine treatment and spine surgery have been excellent and exceptional.
Right.
Okay? Not always that you're going to need surgery.
Right.
But if at all...
What should you do?
Yeah.
Yeah.
But if at all you need, the outcomes are phenomenal.
Right.
So don't worry. Don't suffer through pain. Don't keep on...
Postponing, the inevitable.
Yeah. Don't keep on postponing.
Right.
That just saps away the quality of your life.
Right.
If you need some treatment or if you need surgery, it has great outcomes. Just get it done and live a pain-free life.
Wonderful. And on that note, that was Dr. Mayur Kardile being candid with Karl. Cheers.
Thank you.
Doctor, this is a fascinating session. Wonderful having you on Candid with Karl.
Thank you, God. Thank you for having me.
Most of all.
A lot of fun talking to you.
Thank you very much.